12:23.
No, yours.
Okay.
Welcome back, everybody. I apologize. For some reason, we were having a technical difficulty, but we are back up. I can't see.
So we are back up, and we are joined by the CEOs of NeuroAI Monitoring and the CEO of MetaBrain Labs.
Okay, I'll get one first.
I don't see live. I don't see.
You should be able to go back.
You'll have to refresh and find it again, unfortunately.
Okay, got it.
Okay, good.
And let me start by saying, hey, F&D Random, how are you doing?
Oh, hi.
We're going to acknowledge some of these individuals that are joining us
Hey,
today.
Helena.
Hey, Rowan, how are you doing? Hey, Helena. These are all regulars that are coming back to hear you all speak. So they're all joining. They're all basically getting off tonight.
Addie.
Right now.
Okay, so we actually have some people who are coming from Facebook also, who are very interested in the clinical trial. Clinical trial?
It's actually a study.
Okay, the study.
Okay.
Interested in the
Thank
study.
you.
Thank you. Thank
All
you for
right,
the question.
so,
So if you're here joining us right now, make sure to share the live to as many people as possible, because you are, there will be an opportunity to sign up at MetaBrain at NeuroAI.com.
At NeuroAImonitoring.com.
And you click the button down below that says how it works.
How it works.
We had to explain that to some individuals. So today we have with us, you ready, Kevin?
Yes, sir. I'm Kevin Dayo, the CEO of NeuroAI Monitoring. I'm the founder of NeuroAI and, of course, working with Alexandrea, who is the CEO of MetaBrain Lab. I was here about 2 weeks ago, I do believe, and had a great conversation with the team. I've been working with Justin for a while now, and we are working to make life better for all the members in the community of FNDs.
And also,
And
yeah.
go ahead.
No, I was going to say, and also, yeah, go ahead. I'm sorry.
Okay, I'm Alexandrea Day, CEO of MetaBrain Labs, and I was a therapist 18 years, built software 18 years, put it together at COVID, and I built a digital therapeutic for self-therapy with an app while you wear a brain wave measurement device, so that I can guide therapy based upon how your brain is reacting to the questions. And this is how Kevin and I connected, because now I can use it to measure any kind of brain activity to discover anything that's going on in the brain the way that I built it. So.
All right, so I'm going to go ahead and ask a couple questions that are coming in from the people who are watching, okay? So, Addie has asked, come on, where did it go? Give me that really fast. I'm so sorry.
She said, give me that really fast. All right, let's do this.
No. Well, come on now. Hello. I can't get my computer to move the way I want it to. Okay, so Addie asked.
I'm so sorry.
Does the band that they wear connect to a tablet? And do they have to keep the tablet with them?
Oh, I know this answer, but I'm going to let you guys answer it.
Okay, shall I answer it?
Yeah.
Okay. The answer is that the headset connects to the tablet using Bluetooth. And as we know, when we have Bluetooth, you have about 20 feet to maybe 25 feet. You have to be within range. So the answer is yes. If you're going to wear the headset for monitoring, you need the tablet within 20, 25 feet.
Okay, so the next question that we have is,
Here, I'll ask this one before it
Thank you.
disappears. We have one from the audience. How well will wearables help people with F&D in their day-to-day lives? This has been a constant question that we've been asked on all our channels.
Okay, I think I could answer it.
Go ahead.
Unfortunately, all of the headbands out there, and there's many, they're not therapeutic, which means they don't actually help you on a specific intervention. However, anyone that can look at their brain waves and recognize stress and say, stress I don't want, it's better to be calm and peaceful, then yes, it will help you that way. But to help for FND, that's our goal, is to help with that. But actually the ones on the market are just basically to recognize your stress, and then become more meditative.
So I was going to reiterate that, but I know she's about to reiterate that as well.
I want to ask a question, okay? So the purpose of your collaboration is not just what the wearable is currently for, correct?
Correct.
So
yes.
If I'm going to say it, and I want you guys to correct any way I'm wrong, okay? So what I understand is that the amazing collaboration of these two people. These two people plus the other, but with these two people here is that there's going to be able to be data collection so that I will better be able to understand things that I do that might trigger, because I'm not only going to be having the information from the wearable, but we also, like, as everyone knows, we record at all times.
Yeah.
So we'll be able to pinpoint what I was doing at each moment that it occurs. But also then that data will be able to be shared with my medical team at my discretion, correct?
Well, that's a little bit down the road, but to kind of start from the beginning, it is a data collection platform. And our goal is to collect data from people in 3 steps, in 3 stages. The first one is a baseline. A baseline is when you do your dishes, walk around the house, just basically live life. That is what's called a baseline. The next one we're going to collect, and that's after we take that data and do something with it, then we're going to collect what we call an anomaly. That's outside your baseline, and we're going to send an AI agent to talk to you and ask you what's going on. We notice your data has changed, and so we're going to ask, is there some, what are we using instead of seizure? We're using
storm, invisible storm. Invisible storm.
An invisible storm. Are you having one? And the idea is the person will say yes or no. If it's no, then I can tag that data as a false positive of that storm. And then the third is an actual storm. And then I've got 3 pieces of data so that I can use machine learning to remove the false positives and then know what the 2 states are for every single person individually, which is called personalization. Okay? Once we have that data, then the answer is yes, we'll give you a way to download it when we get there. But the more important thing is we'll use that data to then come up with your own personal neural marker so that you'll get, our hope is in research, in this study, is to know about 10 seconds before that event occurs that it's coming so we can warn and have an alert. And the other piece we're doing that you mentioned, Rachel, is the AI agent's going to talk to you and ask you what happened before the event. And you're going to say, well, I guess I was frustrated. And then if that is a repeated report from you every single time, then we're starting to get some insight into what your triggers might be. And again, the beauty of this system is it's each person individually, and to me that's going to be a major scientific breakthrough.
All right, like in grade school, you ready? Ooh, I saw a question. Somebody asked an important question that we all have spoken about.
So many questions coming in.
They're all coming in now. So one of the most important questions that I've seen in the last 3 seconds was, will it be available in the UK? So in other words, will it be available worldwide?
Kevin, that's you.
That is always the goal, right? You never want to branch yourself too far. But at the same time, you want to make sure you start, it is a control, you control the data, and the most important thing that we need to get from the individual, regardless where they are eventually, is clean data. And that's the key. And removing the false positives. So as we look at individuals to basically be part of this study, we need to make sure that we are able to get positive and negative feedback, right? And you want to make sure that you work with us and you tell us, hey, this is what I'm seeing. So we can actually work with you in the same process. So I know Rachel, talked to Rachel a number of times already, so I know that she'll be easy and just to work with.
Absolutely.
So the UK will be second. Don't we want to stay in the US?
We want to stay in the US for the time being, just to kind of get things going and eventually move to different countries.
And then we'll be multilingual.
Yeah.
Okay?
Awesome.
That's the goal.
Okay, I've got a couple more questions here. All right. One of them is, what is the time period the data is going to be collected before it's analyzed?
Okay.
That's a great question. It will take, so our goal is to do our first 100 or 500. It will take about 3 days for everyone to get their data in. For baseline, we're going to start with baseline, and then I will have everybody's baseline, and I'll be pulling it over. And then we're going to launch monitoring.
Okay.
What I have to do with the baseline is find an algorithm, and this is going to take some data scientists and neuroscientists to tell me if this is the picture of baseline, what would you predict an event would look like? And it's probably going to be 5 times what baseline is. But I'm only guessing. So this is what I'm going to work with you, Rachel. I'm going to use some of your data to look at the difference so I can get a real idea of how different it is.
Okay,
So-
I've got a quick question because I've seen this one a couple times. 2 things. Do you have to have seizures for it to work, or is it just F&D?
Kevin?
Yeah, in this case, regardless of what it is, you gotta have an event that happens, right? And again, you are not dealing with things that are just sample. If it was that sample, everybody would be doing it. So you are working with complex problems. So FND or non-FND, the idea is that you have an event that happens. And here's the thing, as we start parsing through all the data, we may see that using the infrared that the event is at a micro level. But the great thing about the machine, the AI will catch it. When you go to the doctor and they're looking at all these brain waves, you have a human looking at it. So what you're incorporating is human error into the equation.
And they're also looking at baseline.
And
Sorry.
it's fine. Yes, true.
They're not looking at an event. They have to be there when you have the event.
Well, and not only that, but hold on, because I actually had a seizure while having an EEG, but they said I wasn't having a seizure. So what is the difference between what you guys are going to be doing versus what I've already had testing on?
Okay. And so, go ahead. You want to answer?
I would just say that until I see your baseline and I see what your EEG and your blood flow in your brain, I mean, maybe it's just a shift in blood flow. Well, again,
But
we're going to measure.
how are you going to be able to see that difference between what an EEG sees? What are you using to more than just the EEG? So what is helping you see more?
So basically, the reason why this device that I just got, by the way, Justin just came in.
Do it again. Hold on, one more time.
The reason why these devices are so incredible is very simple. They have the EEG, but they have the infrared. So I'm not a doctor, but I've talked to neurologists that talked about it and infrared, because they can. So what the infrared looks at, it looks at the blood vessels in the brain. When you have an EEG event, so it looks like a sine wave. It looks like this. And the infrared, sometime inside that sine wave, you will have an event that happens that's very small, that you cannot see. You may not be able to catch. But one of the things that we're doing with the sampling is that we are looking at every single basically delta of that data and able to catch those. That's the difference. And here's the thing. The other way I look at it is this way. When you go to your doctor and you go to your doctor for an hour, you're watching, he's taking a picture of your life and he's taking a picture of your day. It's maybe an hour and that's it. If I take a movie of your life, which is what the wearable does, then I can tell a whole story. That's the difference, right? So you go to the doctor, hey, I'm not feeling good. The doctor checks your heart. They said everything is fine. You go home and you get a heart attack. Why? Because the doctor monitored you for 10 seconds. He didn't monitor you for the entire day. And that's the difference. And that's where we're really separating everything. And you're home in your environment, not at the hospital in a controlled environment.
You got to say it one more time for the people in the back. The doctor did what? He monitored you for how long?
For
Not
about 10
long
seconds.
enough.
10 seconds.
Right? He checks your heart. It's okay, everything looks good. He says, okay, well, I'm kind of busy. I want to go out. And my buddy's calling me, and he takes a picture of your life. It's almost like, and the way I tell it to people, it's like this. When you go on Netflix or any show, and you want to pick a show, you look at a picture of the movie. And you look at that picture, oh, this is going to be a great movie. And then you watch the movie, and it's a horrible movie. It's the same thing. We are not giving you a picture. We are looking at the whole movie and analyzing the movie frame by frame. That's really what we are doing.
So you basically, in that whole sentence, answered this one question that came up. So basically, the wearable is like an EEG over a long period, long time scale, is what the individual said.
Okay.
But what I was going to say is, why is it slightly different than just the EEG? What makes the wearable different? How does it detect?
Yeah, it's because it's got the infrared.
There it is.
What was that?
We've looked at a lot of devices on the market. We did a lot of research all over the world to find a device that had an EEG and infrared. A lot of the devices that we found were very bulky. They had all these wires over your head. Well, unless you want to wear that every day, then it's up to you, but it's not comfortable. So
You should explain what FNIRS is. It's checking the blood flow in the parts of the brain.
yeah,
They probably don't know that.
yeah.
Okay.
Okay, so I have a couple questions here that I don't want them to leave out. Because someone's been asking a couple question times. Okay, so
And then we'll come right back to that because that's important for them to hear.
It really is, and I'm not trying to interrupt. I apologize.
No.
Okay, so will this help me see if mine are psychological? Sorry, my brain doesn't like to read words anymore. Will this help me to see if mine are psychological or physical, since my doctors can't find them?
Okay, so
I don't know that
She
answer.
cut out.
Okay,
She cut
will this
out
help?
some.
Will this help me to find out if mine
are psychological.
Mine are psychological or physical, since my doctor cannot find them. And of course, that would be for EEGs, right?
Well, no, I think that I kind of want to ask them to
Elaborate.
I want to ask them. I kind of want to ask them to
Elaborate.
I want to ask them. Have you been diagnosed with non-epileptic seizures? So this is a question that one of my team members saw in the comments and put up for me. So I didn't get to see the name of who it was. I apologize to the person who wrote the comment. If you can give us a little bit more information on what your question is. Do you have non-epileptic seizures? A little bit more information on what your question is. Do you have non-epileptic seizures? And if you do, what has your doctor said? Has your doctor said that you have psychological seizures or... Okay, so...
But I will say this one, because I can go right back up while you are able to relax for a moment. Once an application is filled out, do you get medical records, then approve the wearable, then get approved for the wearable?
Yeah, this is very early research. This isn't even medically approved. It's not a medical device. It's a monitoring system that will lead over the next 2 years to a medical device. The FDA takes $500,000 to get through and 18 months of fighting to get it approved. That's the journey. And we're doing the preliminary now, data gathering, and we'll use that data to go through it. But people that are helping us gather the data benefit by kind of a wellness approach. In fact, if we see the signal change, you'll get an alert, but we can't make it a diagnostic. It's simply an alert that maybe there's an anomaly coming and to sit down. So there is benefit, but it's going to take us at least 2 years to get through it where it's a medical device. And then it will be covered by healthcare, by insurance.
So the person responded. She has been diagnosed with non-epileptic seizures.
So on that note, I want to say this because that was important, and that's one of the things that we have been saying, but we backed off of saying it for a little bit. But yes, the alert statement right there.
Yeah.
The reason why Rachel and I switched over to iOS is because of the watch from Apple. Because when I first started having the invisible storms, I was falling all the time, constantly,
and like it was to the point where like I would be fine for a couple of days, and then all of a sudden it would hit out of nowhere, and I would be on the floor having a full-blown invisible storm episode.
And the reason why I brought that up to the audience, and I need you all to hear me, is because the important statement was you would receive, after the device starts to understand you, you will receive a alert letting you know that there may be an invisible storm on its way, giving you enough time and giving your your support system enough time to help you in that situation. Unlike the Apple Watch right now, which gives you an alert 3 seconds after you have already been laying on the floor. And so that's why I thought this is such a beautiful device.
You then have 11 seconds.
We can make it so it can actually hit your watch as an alert.
Say that one more time.
We could even engineer it so that when that storm is indicated, it could give you an alert on your watch, and you could sit down immediately.
So I want to say something really quick.
Right there.
Yeah, I know. Hold on to it. Just hold it.
Okay, I'm gonna hold it.
Yeah, I'm 100% serious. I want to say this really quick. So one of the reasons why we have been talking about this nonstop on our lives, even before Alexandrea has been on here, with Kevin, without Kevin, one of the reasons why we have been so adamant to get the news of what you're doing out there is because I know I lived with it for years with no hope. And honestly, what I feel like the three companies, you two people are honestly giving people who have the non-epileptic seizures like myself is a little bit more hope.
Yeah.
You guys are Santa Claus.
But no, if you stop and think about it seriously, because I actually had a conversation with our team today about how I've been really in a bad place and I can feel that I've not been doing well lately. And I've been having more of the invisible storms. And it affects more than just me, because now this affects my family. And so what you guys are doing, it is able to help more than just the people who have this. So what one person said was
that could be amazing. That is my that may alert you. And that we were able to get to that point. And this comment is why I said this. Okay, you guys are here. Everyone who's watching right now, you guys are here at the ground floor. Like, we are getting ready to build the rocket. Yeah, y'all asking questions about 2 years from now, but you're not. But you're also realizing that you are in at the ground floor, meeting the individuals that are going to be doing this for you. Which is why I say there is no greater feeling than meeting these individuals that care about these communities.
Okay, so this
and are building this for you.
She's asked this question 4 times, and I keep seeing it. I want to ask it before because I don't want her to feel like we're not hearing her.
Okay.
So this person is new to F&D, and they would like to know: would this help undo the misdiagnose and confirm symptoms?
I believe so.
We have to be FDA cleared to be able to do that. So
right.
Yeah,
we're a little bit
before that statement, I'll say it. Before that statement is actually made,
give me a second. I gotta
allow them the opportunity to be FDA cleared. Am I still there?
Hold on. I just got it.
We're gonna lose connection because of our Google thing. So I think we need another invite.
Yes.
So everybody stay. Everybody stay. We're gonna send you a new invite.
I just extended it.
They switched places.
And So I will say the one thing that we are, and I'll
Just
probably
15 minutes, yeah.
yeah,
15
the
minutes
one
left
thing
to
I
do
will
again.
say is that we've been trying to do, and the mission is to basically give a level of independence back into people's lives.
Yes.
That's really the key for it. It's like you get a level of independence so Rachel can go and mow the yard and Justin can do something else in the process.
Woo! Say it again. Justin needs a break.
I miss doing that though, so that's
No,
not fair,
I'm joking. I'm
Justin.
joking. High five. Got myself. All right, there we go.
No.
That's cute.
Yeah.
So,
All right, we have so many questions
there's
that
so
we
many
haven't
questions
gotten
that
to.
have come
So I
through.
want to ask this one really quick. Would teenagers be eligible?
Yes.
We'll let
Yes.
them answer.
Well,
Absolutely.
No, that's not what I wanted to do.
yeah. So, to answer that question, in case you didn't hear them, yes, teenagers will be eligible. I know you just made the day of so many individuals because on my Facebook page, I have so many parents asking questions about
Yes.
functional neurological disorder as a whole and letting us know that their adolescent teenagers and below have non-epileptic storms. So I'm so glad that you all answered that for them. And if they're here, we're glad you can hear that. And there's so many smiles and hearts and thank yous.
All right, so someone is asking, so the wearable and everything, is this going to help in finding the common denominator for the invisible storms?
So the way, and I'm sure Alexandria can answer that, but the way I look at it is that, now I've talked about this many times, in everything that happens in life, in the universe, or whatever it is, there's always a pattern, all right, and that's a key. But the thing about invisible storm is that everybody's unique like a fingerprint, and that's why you can't, when you go to the doctor, the same doctor cannot basically have the same solution for everybody.
Mm-hmm.
And as we basically use the AI and the machine learning, it learns about you, about how your brain functions. It learns about, if you are, hey, it's getting cold, so I have a storm, or I'm upset, I have a storm. So that's what really the difference is. But the idea is to really give the independence back to the people's lives.
Which I would
So that
absolutely
they
love
can
that. I
go
won't lie.
driving and they can go to an event, not have to.
And also, with AI and machine learning coming in right now into our lives, this is actually what's making it possible to do what we're going to do, okay? Without it, it'd be tough. We'd have the data, but we'd have a hard time, I think, analyzing it.
Yeah.
So it's a miracle, and we get to see AI in our lives helping us with our health.
So I have someone who's asking if they would qualify. And so they said that they have FCH with drug-resistant seizures with invisible storms also. Would they qualify?
Yes, I'd be very interested to study that.
Okay,
Yes.
so Jess,
Remember,
Jess,
everything is
please
unique
make
to
sure.
each person. So it doesn't matter what the labels are. I can't hear her.
Yeah.
Excuse me, it doesn't matter what the labels are because those are diagnoses and we're looking for patterns. So it doesn't matter what they have. I will have a unique picture on every single person.
So you ready for this one? 71 people are in this live. Out of 71, there is a good percentage that some of you have non-epileptic seizures. Take a moment right now. Go to NeuroAImonitoring.com. Scroll down to the bottom. Click.
How it works.
There you go. And sign up to join this trial.
Okay, so I saw something and then my phone, of course, glitched. Where did it go?
So, and it was,
Come along.
what was it? It was Jess, right? That
Yeah,
said-
Jess.
So Jess, make sure you're one of those individuals. We'll make sure we,
India Grace said that they signed up, but they are in the UK. Addie has signed up her 17-year-old daughter. And so these are all people who are very interested in at least getting information back so they can understand more about what you guys are doing.
so we have, okay, I'm waiting. Oh, that's not a question. Okay,
No.
I'm waiting now for evaluation. Okay, so that's not a question. Anybody else have a question? Because we have plenty of questions that we can ask. But I'm waiting for you. How do I sign up? That's not the question. Look.
Can you put a link to the page in the chat?
We actually have it up.
We have a link in our bio, and
so what I will say is, one of the lifeguards, yes, I said lifeguards, nobody's drowning. One of the lifeguards, please find, what is her name, Marlena, and teach her how to go sign up, please.
Helena, amazing.
So thank you,
our
Helena.
Community, I just want to let you guys know, our community is absolutely amazing. The ones who have the invisible storms and the ones who are just here for support, they are very helpful for the people who are in the comments who are asking questions. So I don't know if you guys are watching, able to see any of the comments, but thank you everyone who is watching, who's commenting, who's helping out. We appreciate every one of you.
Now, do you all, hold on, there's a...
India asked a question.
Hold on, real quick. Do you all have a social media platform that you want, or a social media that you want them to go follow?
Did Kevin just send an invite?
Yeah, I have the NeuroAI monitoring
I need you
on
to
TikTok.
About
That you guys can start following. I'll be posting more content on there. And as we go to our journey.
And you said India asked what, Rachel?
Asked if the bill where.
Okay, India, I already read this. India wants to know if they will be able to wear the wearable at work and at home. Can the device be hidden? Remember, Kevin, we had this conversation before.
Yeah.
So someone can wear a hat, they can wear a scarf, so it can be covered without problem.
No, and I'm gonna say this: it's not like you guys have the device with you right now.
We do, but
We do.
It's not closed up.
I mean, we literally do.
I don't have one.
Is it almost dead?
Yes.
Hold on.
Hey, Kevin, did you send a new invite?
Yes, I did.
Okay, let me find that really quick. So, give me a second because I gotta move off of where I'm at. Okay?
Right.
Sounds like a plan.
Here you go.
Can you do
No,
that?
we got the new devices here, and I guess this one just arrived today. I got these two arrived today.
You good?
And Alexandrea, I know you got yours.
yeah.
So,
There it is.
I'm sorry, it's small,
Get off
guys.
here.
yeah, I already sent the
I'm
new
trying.
invite.
I'm trying. I'm so sorry.
Stick with us, you all. We gotta update update this for everyone, so we don't lose them. Everybody left. Oh no, everybody left. We're down to 0. Totally joking. Totally joking.
Okay, so it says that no one else is in there.
Really,
You ready to
right?
move over?
Oh, so just go to the next meeting?
Yeah, let's go ahead and move over. You ready?
Oh, sounds good. Yeah.
Okay, everybody. Since you're just joining us, Kevin's not here right now. Okay. So everyone, thank you, Christina.
Oh, Kevin just joined. Don't say too much.
So since Kevin is not in here right now, everybody take a minute and go make a grilled cheese.
I'm already here, and I know the grilled cheese, the grilled skills. My grilled cheese skills are better than your grilled cheese. No, I hit that button so fast I was back on
That is a complete utter lie. I have the best grilled cheese in the world. Kevin is lying.
Yeah, well, we both make grilled cheese before our kids because, they on the spectrum and they love grilled cheese. So.
Shoot. Sorry. Okay. Let me get back to the questions. It looks like, okay. I'm trying to use your mouse for my computer.
Yeah, somebody said it's too hot to cook.
Okay. So someone asked a question of, would this monitor other things that are associated with FND, like the stomach pain, POTS, migraines, or tics?
Oh, and before you answer that, I would like to say, also mention what it does already.
Already?
Yeah, you have to get more information on that. We're confused.
What do you mean?
The Athena S, or S Athena, right? The S Athena?
Oh,
Go ahead and explain to the individuals who are new, because we have some new individuals joining us. Go ahead and explain to them what that device already does for them at this time on the market.
So this device at this time on the market helps you kind of help calm yourself, your brain down. That's the idea. And so they've added infrared to basically further learn how your brain activities, what happens to your brain, how you calm it down. So it has exercise, I do believe, to help you calm down. Breathing and etc. Now, here's just think about it this way. Your brain is basically like a black box. All right, and anything that happens to your brain, and let's say your stomach hurts after that, all these things, those are usually after effect of the event, right? So something happens, let's just say 5 minutes before there's an event that happens, and what you do is a reaction. It's basically like you drop a rock into a lake, you get a ripple effect. Where you drop the rock is where the event happens. The waves are the after effect of that rock. So you could have like tremors and all the different things. Those are after effect of the event. And so what we are trying to catch is the event.
And we collect behavioral data.
Yeah.
So if someone is also having a migraine at the same time, I'm able to collect that and tag it. Because we map the conversation with the data. If someone's having a stomach ache, they can self-report, I'm having a stomach ache. And it's all mapped together.
Amazing. That's amazing.
Can I ask a question on that?
Oh, that's a good question.
Okay, so you both know my story. We can't talk about what happened to me on here.
Google Rachel Poole 2013.
So we can't talk about any of that. But because of what happened to me, I have constant migraines. Like they never go away. So will this affect my baseline?
Ooh.
Will this will my spiked migraines where they get a lot worse, will they be noticeable because I always have one?
And will the device be affected by the thing?
Oh, I forgot I have
that's
that.
stuck in there?
I would say no, but we would pick up. That's why it's so important. Everybody's brain is different, and your baseline will be much different than someone that doesn't have what's happened to you, okay? So, the answer is yes, but the good thing is we can use machine learning to weed that out, that this is your baseline. So the expectation when it changes will be much different than other people. But until I get into the data and everything, I won't know, but I'm sure it'll be interesting.
So basically, right now, when we started this, it would have been a good baseline. And right now, as it's ramping up with Rachel, you can see her start to move, and she keeps saying, I'm sorry. And I'm ignoring the I'm sorry's because, she doesn't need to say it. But you would be able to pick up everything that's going on right now and send her back a message saying, okay, what is going on right now? How is this affecting you, et cetera, right?
Yes, exactly.
Along those lines. I'm just paraphrasing. All right.
That's 100% correct. Yeah.
Okay, so we have someone who's asking, would this help with pseudo seizures, or is it only for FND seizures?
I believe it can work for any changes in brain activity.
Yeah, remember the idea is that regardless of what we call it and regardless of how we call it, there's still an event happening in the brain. There's still activity happening in the brain, and that's what we are collecting. So for every action, there must be a reaction. And so what happens is that you're getting this different reaction, but there's an action there. There's an event that's happening, and that's what we are catching.
So there's a really, really good question here. How often is the device going to have to be charged, and do you know how long it takes to charge it?
Well, I know it lasts about 10 hours, and I think it takes, so we would recommend putting it on.
When you wake up?
Yes, when you wake up. And then, again, if your pattern is to have activity at night or later, put it on later. If your activity is midday. So we're hoping you have a pattern, hopefully. And if not, it's okay. And it might take, I don't know, an hour to charge it. I actually don't know. But we're hoping to at least capture the events.
Okay.
when you have them.
So question, and this is actually my personal question. So
don't answer it. Okay, answer it.
I don't always have the same pattern.
I knew she was gonna say that. I knew it was coming.
And so, like, let's just say when we're starting my beta test for this, are we going to want to do it where I'm always charging at the same time, or are we gonna want to?
You might want 2 headbands.
Yeah.
He said.
You might want 2 headbands.
Okay, and I know that I'm a little bit different than some other cases that have that same invisible storms that I do, because mine is not a one-part way I have F&D.
Right.
And so because I'm kind of both sides of what the main F&D can be from, I should say, I know that I get different types, whereas some people might get just like one certain type. I don't know if that makes sense. I have to be so careful
the
what I
best would
say.
be like the baseline is here for you, and then the different types of invisible storms that you get, it would pick up on the different ones, and they would be able to see that basically.
Yeah, no, I'm just saying that I know that mine is so much different than what some other people do, because I have the pain spike ones, which I've noticed a lot of other people who don't have F&D don't get pain spike seizures.
Because of the physical thing that happened to you.
Right.
We understand.
Yeah.
Sorry.
I suppose it would mean adding another pipeline of data to then identify this is migraine, this is spikes in pain, because pain will show up different, but it's only built for 3 data pipelines right now.
At this time,
But it's interesting to hear you talk, because I could think of ways to add more of those, to give more insight.
Basically, she's gonna run the battery out in the first 5 days.
That's why she probably needs 2, one charging and one wearing.
Yeah. Somebody asked the question: would there be BCAs? So I think they meant would there be a SD card to record the backup data received through Bluetooth? That was one of the questions.
Well, we're not planning to do that because it's unstructured. It's just numbers. So I don't think it'll be useful. But it'll be in your account, where you, not today and maybe 3 months, you'll get to look at your data and it'll be visualized and there'll be numbers. So yes.
Pamela, you should have your daughter go to NeuroAI monitoring. Go to the scroll all the way to the bottom right now before there's no spots left,
and click the
and
how
click
it works
that
button.
how it works. Huh?
How it works.
How it what? Oh, I'm telling how it works.
Someone asked if this would work for cluster migraines. What the study you guys are working on?
I think we're not going to study those yet.
Okay.
Woo!
I mean, I don't know, Kevin. What do you think? Cluster headaches is different.
I mean, here's the thing. It is not, the answer is not yes, the answer is not no, but obviously we want to focus on first FND and non-FND. That's where we're starting first, getting the tools to basically work for us, getting all the logarithm readjusted and all the different things done, the mobile app done. And as we go to it, and you know what, we may see patterns. We don't know. Again, this is a cutting edge. You know, we are like Star Wars, Star Trek. We're going to new frontiers, and we're really pushing that envelope. A lot of, and I've talked about it before in the past. I talked to a father that had kids with mental health on LinkedIn a while back, and he says the problem is that the medical industry focuses on what the revenue is, and the people that are passionate about focus on solving the problem. And so what we are trying to do is solve the problem. If I had a team of 10,000 people in a massive company, absolutely, we'll just say, do this. We could have different projects going at the same time. But we are all starting small, we're growing. Alexandra is years ahead of me, and but we're still getting there.
Kevin,
no, I would say
she might be years ahead of you, but you are like millennia ahead of me. So at least you guys are like on a level playing field, okay? All I do is fall down a lot.
There it is again. So let me ask you all a question. As far as the individuals with functional neurological disorder, the ones that have non-epileptic, let's say, storms, with this data that will be picked up, will it be able to pick up the tics that these individuals get as well? Like, for instance, if somebody were to go, that's the sound of the police, or DuckTales. You see what I mean?
So I'm trying to.
We didn't get the question.
Okay, so there are certain sound triggers, and so when Justin says or anyone says a lyric to a certain song, I will try and not say the rest of it. I will do everything I can. Like, I am fighting my brain to not respond to it. When there's I guess it's also a song technically.
Yeah.
It's,
so that's the sound of the police.
Whoop, whoop.
Or DuckTales.
Woo.
See?
Yeah. It's triggering something.
So
Yeah.
would those episodes get picked up with the wearable? Is what he was asking.
And what would be interesting is you would respond to the AI agent that says, I just noticed there's an anomaly. You would say, oh, it's from that music.
So question for you, am I going to have to type it in, or am I going to be able to speak it?
You will be able to speak up. You'll be able to speak it. We're doing voice.
All right, and the reason why I brought that up is because so many individuals in this...
Okay, I have another question right on that. I'm sorry.
Go ahead.
Okay, so you said it's going to be a speech. What about for when people cannot respond?
Yes.
Because I will often go into it, and after the fact, I can't speak all the way. And so my family, if they're not there with me,
Sorry, I didn't mean to do that. Which is the reason why I suggested to Rachel a while back when she was having to speak with a speech pathologist just to learn how to speak again, because at one of the stages of functional neurological disorder is losing the ability to have speech. So we ended up going to from iPhones to Androids. From Androids to iPhones. No, we went to Androids in order to have the stylus.
No, you upgraded my
I upgraded her Android for that. And so would you all have the opportunity for an individual to have a stylus with their tablet? I'm bringing it right back around, full circle to that tablet situation.
I'm sorry.
Because some individuals can't speak it or type it at all during those during or after those episodes, but they're able to write it out.
We're gonna have, it's ambient. What ambient means is it's just waits. It waits for you to be coherent enough to communicate.
Okay, so
I hadn't thought of a stylist. We could probably do that. But even if it has to wait 10 minutes for you, okay? It'll wait for 10 minutes. And then you can talk. I can provide buttons where you can just tap a button if you need to.
Okay.
I can post questions. So I know that it's important to make it and to be patient, to wait for you, and then to give you simple ways to communicate.
So what you're not seeing in the chat is that there are a lot of individuals speaking about the tics.
Yeah.
That's why I brought them up. There are people speaking about the tics. There's one person that said my daughter does the snapping and the whistling when they hear birds. And so these are part of the functional neurological disorder symptoms, and so I wanted you all to know about that right now while we're online. I should have called you all. That's thank you.
Yeah.
There was actually a question here. Vic is asking, in regards to the study, would the participant have to pay?
Okay, so the participant does not have to pay for anything. The only thing we are asking them is to get the wearable. Again, last time as we talked about it is that we're not bringing investors into this for a specific reason. Alexandra and myself have had experience with investor in the past. It doesn't go well for you a lot of the time. So we want to keep it, for the community, for the people that have FND, non-FND, and mental issue, health issues, and etc. And so we are focusing on, if you can get the wearable, we have an affiliation with Moose where you get it at a discounted price, and then we work with you and your product program.
They need a tablet.
They need a tablet, and we're working on it.
And then a tablet or
software, you have to pay for that, Kevin.
Yeah, that you have to.
There's 3 parts.
Yeah.
And the affiliate coupon will be on our page, right?
So if you go to NeuroAI monitoring, I think you go on the wearable. And
No, it's by monitoring.
by monitoring, thank you. You go by monitoring on the tab on the top, and you should be able to then get the wearable to the affiliation. And
But the wearable by itself is not part of the program.
yeah,
You know.
okay, so I want to make sure that it's understood. So the wearable is something that they'll be able to use even without the software, correct?
They can't use our software.
No, not that same. But the wearable itself is something that is a product they'll be able to use.
Sure.
Okay,
If they
so
want to.
it already. What does the product already do? What does the wearable do currently without your software?
the wearable right now without the software helps you sleep. It helps you learn how to calm your brain down to sleep. So it monitors your brain activities, and then you're able to see that on your device, and then you basically learn to calm your brain down. So what we need is raw data, so that we're using that wearable to then collect that data.
So
that's really very important.
So one of the things that is brought up just now, and me and you had spoke about this before. Vic said, "Dang, I personally can't afford it. I just applied for disability since I'm unable to work." And remember what I told you about this community. A lot of individuals will most likely be on disability.
Yes.
So how would you respond to that?
I mean, I do believe, I understand, a lot of people deal with disability. And one of the issues that if we had to for example, file a grant to get money to get everybody into the study, that takes a long time, a year to 2 years before you can get anything. So then that delays everything for about 2 years. So for the people that are basically going to FND or FND, I think they don't want to sit around and wait for 2 years. They want to start moving ahead now, and that's why we are doing this now. So I know that you and I, Justin, had talked about maybe helping a couple individuals that could be part of the program. And so that's always on the table. We are looking at everything, but getting the more people that we get into the study, the more data we have, the faster we can move, the faster we can come with a pattern and start figuring out how things work along the line.
And once this gets done in a couple years, we'll be able to diagnose and then use the software to validate treatments. So you might take a medication. I can measure if it's effective. You might start doing yoga, see if it's effective. And that's one of the beauties of we get past this first 2 years, then it's really valuable because then you can try to do things and see if it works for your particular problem.
You're fine. Okay. Give me a second.
I'm sorry. Under my legs.
I'm good.
Yeah. It was.
It's
anxiety with the touch.
sensory thing. It's a sensory thing.
Sorry.
Just a moment. Go ahead, babe.
All right. Since we heard about this, we were talking about fundraising for our child. So that might be an idea that helps. I think that that's amazing because I know that there's a lot of people who can't do it on their own right now. So I think that if you're able to fundraise for it, to be able to get in the trial would be a great idea and help a lot.
Is this something that we can do as, us on JD_ like that with the F&D, and then you all on your part? Is there something, and with Muse as well, Is there something we can do to get together to do a
fundraiser?
fundraiser for the first 100 individuals to receive the device? Is there something we could do? And that means reaching out to corporations to see if they would be willing to donate, reaching out to the audiences and everything like that. Is that possible?
I'll say so, yeah. And everything is open book, and I'm not opposed to anything. I think Alexandria is not opposed to anything. And Justin, I know that fundraising is something you're good at, and you guys have done that before. Personally, I haven't done that. I'm usually more investment and different things like that. But one of the things you have to do is like, okay, two things you have to happen. You got to be able to raise the funds, but you also have, once the funds are raised, you have to be able to reach out to the individual that have signed up and get a hold of them. If we raise the funds and you don't sign up, then you're gonna miss the boat. That's basically what's happening.
So the first step is honestly, if you're interested in trying it, if you're interested in this brain just stopped working.
I got you, babe. If you're interested in trying the trial or the opportunity,
then
you have to go sign up first on NeuroAImonitoring.com and hit the button at the bottom. This big and green that says
how it works.
Well, this is how we do it. Oh, it just says how it works? All right, how it works.
Yeah, I mean, and that's basically, so if you sign up, then at least we have your name. We have all your information. And as we get the numbers up, then at that point, then we say, okay, great. We have the fund to be able to help the individuals. We can do that. And if the people have the ability to do it now and purchase the wearable, then we can get started. I know that Alexandria we're almost ready to go anytime. On her side, she's good to go. She's had that system running for a while. On my side, we're getting close to getting everything done now.
We just got the Muse headset yesterday.
Yeah, I got mine too, right?
I know, but so it's going to take us a little while.
Yeah, exactly. I think here's the thing about, I've talked to Ariel, the CEO of Moose. There's a back order on this. I mean, you have companies are buying this wearable is literally. I waited. I think I ordered this one 3 weeks ago, and it just got here because it's such a back order, and so we want to make sure that people sign up. Get the wearables because that's going to take a little bit of time to arrive, and then once they have them at that point, hopefully we're all ready to go.
What's the question?
All right, so we got a question really quick, Kevin. So for parents, do they sign their child's name or do they sign their name up?
I like for them to sign, the parents to sign the name.
Okay.
And then we can reach out to the parents and talk with them because it's better that way.
Okay, so parents sign up to be a part of the trial for their child. So the parent is the one that signs up.
And I guess like he just said, and like we've been saying too, it is important for you to sign up as soon as possible because there are back orders on this device. You don't want to miss out on an opportunity like this, especially because it hasn't been offered before like this, where you get to meet these individuals and you can see them on the screen. You see how much they care about this. So let's really give them everything we got by signing up for this and not missing this opportunity. I don't want you all to miss this opportunity. That's why we stay up and we do what we do. All right, let's move on.
Okay, so someone asked, is it like $937?
Oh my goodness, really?
Or $1,700?
Julie, knock it off, Julie.
For the device.
Oh, there's three parts. The tablet's like $110. The headset's about $420. And then the software is $650. So that comes up to about $1,200.
Now the software, it covers you for a whole year.
Yes,
so
for a whole year.
We want to make sure that you understand that the software covers you for a year because what happens is when you take that data from the tablet and we move it to a cloud-based system that runs, we have a bill paid to Azure and all the systems that run those complex calculations. And so because of that, that's why that cost comes in.
Yeah, and one individual said priceless. Because think about it, it is priceless because if you were here from the very beginning of this is only stage 0. Literally. It's stage 0.
We froze. Okay,
Yeah.
we're
There's
back.
going to be so many more stages with this, and the technology has so many implications, and it is just wide open to what it can help you do. But it already will have the possibility of doing more than the Apple Watch does for you at this time.
Oh, yes,
There's,
yes.
there's a
Yeah, I like
statement.
them. I mean, I think one of the things that a lot of people have to remember, a lot of people on TikTok, and if you've been on TikTok lately, you've seen what AI can do just at a basic level, as far as videos, as far as animation, but you're not, and so AI is really pushing the envelope at the cutting edge of technology, and because of that, it's changing the world, and so we want to be part of that, and we want to help in that process. Yes, Justin, you don't have to raise your hand.
That's what I do. I'm
One
sorry.
individual said, I want y'all to be aware, there's some people with F&D that can't speak or use their arms. Now, before Vic came on here, we had a conversation about, the loss of speech and the loss of limbs. So we did have that conversation. But to reiterate that, what would you all implement in that type of situation if these individuals didn't have that?
I would imagine that person has a caregiver, so the caregiver would be communicating on the tablet for the person. That's how I would do it.
Okay, so someone's asking if FCH would be enough of a diagnosis to qualify. I think the only qualifying factor right now is non-epileptic seizures, correct?
Yes.
She said, blah. She just shushed me. Did y'all see that? She
I
shushed
did
me.
not. I did not.
Yes. So, to answer that question, grand mal,
Non-epileptic.
grand mal, non-epileptic.
Am I correct that the qualifier
F&D.
is the non-epileptic?
With storms, non-epileptic. There are a few others. We name them all the time. But yes, if at all possible, would you all want us to come up with a list of non-epileptic and put them on our page, or would you all like to do that?
Here's the way I would look at it a little bit. And I know a lot of people are focused on the name of the storms that you're getting, FND, not FND, etc. When you look at mathematics, you're looking at just data, right? Do you have an event that happens where there's a reaction to your body? If the answer is yes, then we want to monitor it because there's a story behind it, and that's really the key behind it. So it's not like you have to. It's like if you're a normal person and you don't have any storms, invisible storms, then you find that you don't have to be part of the study. But if you have them like Rachel and some of the individual, and you want to be part of it, then great. We want to be able to work with you and start communicating with you and get into that journey with us. Now, and here's why that's very important, and that's the most important thing. And I've stated that before. Doctors don't communicate with the other doctors. That is pretty simple. Doctors don't communicate with other doctors. So, doctor in New York is not talking to a doctor in Topeka, Kansas, or in Kansas City, or in Colorado, or wherever they are in Austin. They don't. They are in their office. They do you come in. They diagnose you, they run the test, and that's it. Unless you're part of academia research, you don't know. And sometimes we don't know how those research goes. So this is important to get that data.
And also, Kevin, in healthcare, there's an issue with they're looking for one size fits all.
Yeah.
This is what a seizure looks like. You don't have that. So you don't have that diagnosis. So there's a lot of misdiagnosis probably, and there's probably the inability to diagnose. I think this is a game changer with this product, so that in the future, it will be the tool that provides a diagnosis.
So
I have a
here,
question.
I was gonna say, here's a good question, real quick. If you wear it in your sleep, will it catch the seizures, the non-epileptic seizures in your sleep? Yeah, I'm starting to slur.
I think that we're going to try to stick with people that have them during the day, because we want all the test subjects to at least have that similarity. If they're sleep FND, I think that we should wait to not have them in the first group. Okay? But, of course, it would catch it. If they don't wake up, do they wake up? That's the question. Can they communicate after that with the tablet?
Here's a question I have for you. Speaking about that, because when you say if they wake up, or if they don't wake up, right? We all have come to this page because you all have seen the grounding techniques that I used with Rachel. Will that affect the test?
Sure, it'll probably change it.
So does that
And
mean
actually,
they're gonna have to
they say the
run
study.
through the whole thing? Because
So should I let her stay in the non-epileptic storm for like 25, 30 minutes, which is possible sometimes?
I would say during the beginning phase, where we're starting, yes. But
You heard her
after
feelings.
we get into it, then no.
Yeah, you heard her feelings.
I don't want her to suffer. I don't want her to suffer. No.
sorry, I'm okay.
Okay? I just want to make sure you're okay.
Can we have a cutoff period for the time? Is that okay?
Yeah, I mean,
Because I've had them for
Yeah,
3
I mean,
hours before, and I don't like that.
how long have you had them before?
I've
3
had up to 3
hours.
hours before they stop it.
Oh, no.
Okay, well, you're a different case. I mean, we'll just have to. So probably not then.
No.
I don't.
We'll definitely work with you where we feel like you
Oh,
Yeah,
so I agree and I disagree. I think that I'm here. Babe, I'm here. I promise I'm here.
You're not gonna sleep for a couple weeks. We're gonna need someone to come stay with us.
Yeah, I won't sleep then. It's fine. I don't do it now. So, for like, if you have one that lasts that long, we'll sit through it together. But if it gets too extensive, I'll make sure I get you out of it. But we need to do it for
I know.
It's not
I know it's for the study.
Yeah, it's not just for the story.
I
It's
know
to,
that.
It's to help the world.
Honestly,
so.
the reason why I'm doing this is not for myself, because I'm okay with the way I am and how everything happens, and I don't really care when doctors don't believe me and give me fits.
She does. She does care.
I care, but not to the point where I'm going to go and lock myself into a hospital and not be around my family. Like,
Right.
so what I want to say that, like, what you're doing is absolutely amazing, and I cannot wait to be a part of it. But without you, I'm not going to stop being me with my everything.
Right.
So I'm actually doing this for the community, 100%. You know, like, it's not a just for me thing.
Right.
So I know that the data that you will receive from using my messed up head.
Yeah. Like, for instance, the comments that just came up while me and her were having our moment. My child has had them for hours as well. You're not alone.
Man.
And then another one, I get them for 4 hours. I hurt so much. These are back-to-back comments.
Yeah.
I couldn't imagine. Seizures hurt. Justin, your techniques has helped my sternum so much. So thank you. You're welcome, Vic.
So we want to.
These are the
So
comments.
one of the things I want to make sure is that and the comment can pretty touch me about the daughter having seizures for that long. Please sign up, and so we can work with you guys. Don't be shy. It's something you just gotta reach. You gotta take that chance. You gotta jump. I think one thing is that we are here to work with you guys. We are here to work with Rachel and Justin. Justin has worked with me long enough to know the kind of person I am. So let's make sure that we get there. We sign up so we can start moving in the right direction.
Yeah.
I've never experienced a seizure. I've experienced a cramp. That's painful.
Oh, knock it off!
Kevin, that's exactly it. You understand perfectly.
I mean, honestly, that's what happens when you make mediocre grilled cheeses.
I've had a Charlie horse in the middle of the night. Don't feel good. So,
It is.
I can't imagine it for 4 hours.
I want to say this as a caregiver, as a spouse, as an individual that is also 100% permanently and total disabled veteran. I have had the Charlie horses in the middle of the night next to my wife who has seizures, and I have screamed out in pain. And I'm telling you, it's not a good look when she's
It's not.
silently going through a seizure and I'm screaming out in pain like, baby, stretch me out, stretch me out, stretch me out.
Wow.
Yeah. So we want to make sure that.
Sorry.
It's okay.
But I think we're doing the right thing, and I know that the partnership that we have with Justin and Dayo and Alexandrea is a great partnership, and we'll get there. And I think when I talked to Alexandrea, it was the level of confidence that she had in the product and the team that she has behind her. So I think that we're in good hands. And I remember when I talked to one of the doctors about the infrared, and they said, that's the key, because some hospital cannot diagnose, I'm sorry, but can detect those changes like using infrared. So it's very important to have it. That's why we didn't just get a device that had an EEG and that's it. We wanted to get a device that had EEG and infrared for very specific reason, because without that, then we basically are not getting what we need.
I'm sorry.
It's fine. It's fine. I got
Sorry.
it. Were you responding to a comment?
Yes.
Was it the one about the ticks?
Yes.
All right, so I'll say it on there. So for the individual that's brand new, and so we periodically say this, go Google Rachel Poole 2013, because if we say what happened to Rachel and how she developed all of this, then we will get a slap on the wrist. So
by not being able to be visible for a while.
By not being able to be visible for a while. We won't do that to the community anymore. So please go Google Rachel Poole 2013 and come right back.
I need you to ask this question.
The question that she needs me to ask is...
What did you do?
I didn't do anything. I'm not doing anything. It just keeps changing. What do you want me to do?
Oh my gosh.
Oh, wait,
I
where
cannot
is
with
it?
you. Here, the bottom of this one right here.
Would it work as a general symptom tracker? For the wearable device. Ow, bro. Getting old. Crap. Ow. Sorry.
Oh
Ow.
gosh, Justin.
Sorry, we're both sitting right next to each other. I'm in the dip and I got hip problems. All right, we're good. Will it work as a general symptom tracker for as a wearable device? Woo, that one took me out.
No, I don't think the headset by itself tracks symptoms of any kind.
Will it, with your software, will it work as a symptom tracker for the episodes?
Now, if you're using our system, it does track your symptoms at the same time as the data. So yes, you can have all your symptoms listed. And the goal is ultimately to use AI to have your profile updated so you can actually look at some of these events and then start looking at similarities. That's what AI is good at, patterns. So it'll look and say, 7 out of 10 times you have been doing X that has caused X. So maybe don't do that. But again, we're in very early stages. We need the data.
Now, what I will say is you all have been amazing. First of all, thank you for joining us. I'm saying that on behalf of the entire community. But since I don't like to speak for the community is about to thank you for joining us.
Oh, so you're asking everyone to throw in their...
I didn't hear anything, so I'll say it for them. Thank you for joining us. And as well as, if you all would like to stay on a little bit longer, we're about to hit 10 o'clock. It's actually 9:36. If you all need to leave and take a bathroom break or go get some grilled cheese or something to drink, just let me know. Because at 10 o'clock, the same audience may stay on, but the other side of the world will be waking up and joining us.
Jumping on,
So you're more than welcome to stay on, or we can go ahead and do this another time. So it's completely up to you all.
One of the things we want to make sure that we bring in Ariel to the call.
Oh,
and
amazing.
So we can set up a time and a date. I know she was flying. She apologized because she's flying from Greece right now. And so she's trying to make it back on time. She couldn't make it back on time, but we can set up another time and get everyone here with Ariel so she can talk a little bit more about the wearable. And at the same time, we are working with Samsung to kind of get some affiliation so you can get discounts on tablets and all the different things like that. So,
yeah.
Okay, so I think that it would be best for us to let you all go, have family time, have sleep, because you all have been working extremely hard. I've spoken with you all. I know what you all are doing. I'm so proud of everything that you all are doing to help. And there was a little hand in the background. And so I know that it's probably time for you all to get off. And the next time I think would be best for us to get on is once Rachel is wearing the wearable. So that not only you all are able to speak about it, but they're able to see the wearable on actual Rachel's head. So
yeah, right.
Yeah.
There it is right there.
What is that, Kevin?
You'll be getting those.
So I'm guessing Rachel's going to need both of those.
Yeah, she's gonna need both of those.
Yeah.
Oh man, come on. You guys make me feel.
So thank you for joining us. At this time, you may sign off.
Well, there's
once
one
again.
question, and it's been asked for a little bit, and we just have been talking about something else. I didn't want to interrupt.
Well, go ahead.
Okay,
Go ahead.
so they're asking, would the severity of Tourette's show on the device?
It should.
It should.
Yeah.
Yeah.
All right, I saw someone's question come up, so I wanted to make sure. Oh, they want to know when I will have the device.
I just got it. It just came in today.
When did
So
you get hers?
it's literally, these are yours right here. So.
Jesus Christ, boy, what are you doing? You gotta warn somebody. Put a bell around your neck.
Justin. Oh my God.
Kevin, why are you in the camera? Get out of here. Scared the bejeebus out of me.
You know what's happening, Rachel? He's hungry. Last time he was eating at
Hey, at least he didn't eat in front of you tonight. At least he didn't eat in front of you tonight.
Kevin, you know I'm heavy. He shook the couch. He made the whole couch like move. I thought it was me. I'm heavy. I couldn't believe I moved.
Oh God.
All right. So thank you.
I'm so sorry, everybody.
Oh Lord, Jesus. Clutch my pearls.
So the next time you'll be seeing us, Rachel, you will have the wearable. I know that the engineers on Alexandria's side are working day and night on basically working with the wearable and the AI tool. So we'll make sure we also get you guys your T-shirts and all those things like that.
Yes.
Alexandra, thank you for replying to that comment in the chat. I appreciate
Look
that.
at I have no idea what happened. You know my soul left my body, so I'm back now.
Someone said if they are traveling, how do they go through security? And Alexandra responded, you put it's with a cell phone, so you put it in the bin or you pack it in the suitcase.
Okay.
So,
And they're going to be like, and that's perfect, because they're going to be like, well, what's this?
Pickle said you want to make sure you knew that the picture.
I'm not looking. So thank you for joining us. We're going to let you all go. We're going to stay here with the community and answer any other questions they have for us. So thank you so much for joining us.
I really appreciate
Once again,
you guys
thank you.
so very much. You have been, everything you're doing is absolutely amazing. So this is Alexandra Day and Kevin Dayo. Alexandra is with MetaBrain Labs. Kevin is with NeuroAI Monitoring.
Sign up.
The sign up is at www.neuroaimonitoring.com, and you scroll down so you see the How It Works button.
Or this is how we do it.
No, this is how it works.
No, this is how we do.
This is how it works.
This
No.
how
No.
it works.
Yes.
There it is. You all have a good day.
I really appreciate that you guys came on and took the time to talk with us. Kevin.
Let me go turn this off really
Oh
quick.
my goodness, I cannot with you, sir.
Boy, he tried to jump me. You saw that?
No, I did
He tried to
not.
jump me.
Did any of you see Justin get jumped?
Your cat tried to jump me, Rachel. I'm not playing with him.
I'm just saying, did anyone see it? That's all I want to know. Baby Club, I'm glad that you found something that helps you. Oh man.
How do I turn this off real
I
quick?
don't
Hold
know.
on.
You just spend it.
Oh.
You spend it. There you go. Look at you. Is there settings? I can't see because I'm too far away.
Hold on. No. Everybody's right there though. Hey, y'all can keep talking to Rachel. I'm gonna figure this out.
I could be scared so easily by a cat.
Bro, I'm never scared of anything. That was the first time I was not expecting that. I was not expecting that at all. He like tried to take me out, bro. Probably
Justin
because.
said, I just saw a good boy who was trying to say goodbye to our collaborators.
Nah, he needed to get out of here. He needed to go, bro. He
that
took
was
me
so
out.
funny.
So yeah, I guess in order to get out of this, I would have to I don't know, turn off the thing. But anyways, we're good to go. I mean, it's whatever.
You can just leave it.
Yeah, I'm gonna leave
Is
it.
anyone mad about that?
Yeah, I know it's a distraction for me, but
Yeah, but you'll be okay. I promise.
yeah.
Look at all those GGs.
First of all, that wasn't even Gigi.
That was
That was
Bear.
Bear.
I'm close.
And I know y'all have never seen Rachel's cat. That is actually Rachel's cat.
Never mind. I need to get something to snack as on.
Oh my God! You wait till I sit down before you said that.
I need a snack as a.
All right, I'll go get it. What do you want?
I don't know. That's why I was gonna go.
You're gonna go get snack?
I'm hungry.
All right, come on. I'll walk with you. Everybody, y'all want to go see what Rachel gets for snack?
No.
Yeah, I'm gonna take everybody with you. What do y'all? You think I'm gonna leave everybody right here? No, that's not how it works.
I need to stop these ones.
All right, come on, guys. Let's go see what Rachel's gonna eat.
I don't think that's very nice.
Oh, hey, it stopped.
What's that?
Hold on. Flip camera.
I only see you. Ooh, you wings.
She can't stand that well after all that. So now y'all get to go in our refrigerator. They said absolutely. What are you gonna get?
I don't know, because I don't want ramen.
Yeah, it's not like we have eggs. We need to buy some eggs. We definitely need to buy it. Oh, does anybody else do this where they bounce? Does anybody else do this?
I'm not bouncing.
Y'all see this?
I'm not bouncing.
See? Yeah. Devin said I do. What are you making?
I made wings.
You gonna make wings? Oh, the wings the wings I made earlier.
Yes.
Okay, yeah. Oh, careful, baby.
Fine.
I got you. So if you enjoyed the live, put a thumbs up in the chat, please.
I'm burned, so I only do 6.
You want to do 6, baby? I got you.
I'm fine.
I got you. You okay? Don't go down. Please don't go down. What are you doing? You're not allowed to have a seizure after you put chicken in the air fryer. Don't me. Oh, my goodness.
I'm sorry.
What? You can't come back like it's Toy Story.
So nice. I think I sit down now.
Yeah, here, you need me to walk you to the table?
No. Will you get me, I want dip for my chicken.
Dip? Like what?
I don't know. I don't know what tastes good with it because you had it. Do you think honey mustard or
I think,
barbecue?
well, it's a sweet. I put a sweet dry rub on it. So, you need to sit down before you fall into everything. Look, you're not even walking in a straight line. That is not what a straight line looks like. So you need to go sit down.
Oh, you're gonna make me fall.
Ray, sit down. Baby, you almost there. Woo, you almost had it.
That's not nice.
Here, take the phone. Let me flip the camera around for you. Bam. Hold that.
Okay. Hi, guys. I sat. I did.
Ask them about what they thought about the live.
So, okay, yeah, Justin asked, what did you guys think about everything that happened tonight? What did you think about the comments, the conversation?
Everything.
All of it.
What did you think about the owners? I mean, the CEOs.
Addie said it was very informative.
Oh, Addie said it was boring. No, I'm joking. It was amazing. Weren't they amazing?
Nicole said that she was very intrigued. Kiana, you missed out on the conversation from Kevin Dayo from NeuroAI Monitoring and Alexandrea Day from MetaBrain Labs.
I'm making myself something to do.
Addie said they were amazing. I'm so glad that you guys got any kind of benefit from hearing them and what they're trying to do. I'm so excited that we get to work with them.
And tell them that the thing is in.
Yeah, Kevin has the device, and so he will be sending it to me soon. So
if you missed the line today, you missed the device.
very interesting, and it gave me hope that there will be some options for people with this disorder.
Say again?
Very interesting. It gave me hope that there will be some options for people with this disorder.
Absolutely.
And someone said Kevin and Justin, though, those two and their grilled cheese sandwiches.
I need you all to go follow him on his TikTok page.
Everyone needs to go follow NeuroAImonitoring.com, .com. NeuroAI Monitoring's TikTok. Sorry, I apologize. I'm sorry. Woo! Morgan, I'll go to look at it later. I hope that you had a good day, babe.
I did. Thank you, babe.
That's gonna be loud in my head. I'm sorry. I had no control over that.
Am I not allowed to have one?
You can do whatever you want, sweetheart. You know that.
That actually hurt my feelings.
I did not have control over that statement, and I am really sorry.
That hurt my freaking feelings. Oh my god.
Ooh. Oh. I love you.
So, it went from you needing one device to them watching you today and was like, now she's gonna need both of these. She's gonna need both of these. Nah.
Oh, man. Guys, look.
That's hilarious. Because it's true. You actually will.
Oh, man. I'm not really excited.
Well, I mean, okay, so let's talk about it for a minute.
I'm so glad that you've gotten anything from us, Addie. The ticks and tumors are getting worse. Oh, Nicole.
They need you to stay in it for a little while.
I know.
And so there will be no more taking you out of it.
I know.
But we understand that you're doing this for the community.
I wish that we could send the kids to live somewhere else until it's done.
No, baby.
I don't want them to see me go through that.
I know.
Oh.
Don't get sad.
I'm fine. I'm fine. That's so amazing, Morgan. I'm so proud of you.
Right, so
Nicole, I understand that feeling.
Right.
What?
They said, and this is for everyone, they said in the first 3 days, that's when they will be
Getting the baseline.
Gaining and
Check my
measuring the
wings.
baseline. What?
Check my wings.
Gaining and measuring the baseline. So if the kids needed to go somewhere for the first 3 days, I'm sure we could figure something out.
Yeah. See, I think I would really like if we could do that.
Okay, I'll see what I can do. I'll raise some money and send them.
Does not getting enough sleep make my storms worse? I get a lot of sleep. My body shuts down and I sleep. So I don't have a lot of lack of sleep. Would you agree, Justin?
Yeah, no, she sleep all the time.
Random. Oh my gosh. Okay, so when my storms first started, like back in 2022, when my storm first started, we could tell the time of day by the way my body reacted.
Yep.
I was fine until 10 a.m.
Which was weird because you woke up at 8 a.m.
And so I would have a 2-hour period where I had nothing at all. I was driving to the store. I was like, I knew there was nothing that would set me off. It wouldn't start until I got tired.
That was in the beginning.
And it would even be like, I would take a nap and then I would be okay for a couple hours and then I would crash again.
Yep.
I remember everything at all times. I'm fully conscious through all of it.
Now, what most people don't know is I had just had surgery. You were in a wheelchair.
I need something to hold. I can't, my hand.
Yeah, I got you. I'll put it back up there now.
Okay, thank you. I'm
You
sorry.
were in a wheelchair, and I was walking on my leg when I was non-weight bearing, and I had to keep putting your wheelchair inside the vehicle or in the vehicle, and we drove a truck at that time.
Yeah.
We didn't drive a regular vehicle, so.
Love you, Morgan.
There you go. Here you go. Let's fix this so you can be seen.
Yeah, if I see it, I get that completely. Yeah, we don't have to have it in the same place. Why did I left my phone?
What was that?
I don't know.
These are fresh chicken wings that I cooked earlier. I air fried them in the oven. I'll turn this off. Because it's going to be too hot with all this.
Yes.
There. And I'm going to turn this light
I
on.
has chicken.
That okay? They can still see you?
I think so.
We might need the soft light.
Well, that's a nice flavor.
Nah, I think the one of these should be fine. Didn't do much, but. All right, everybody, get ready.
He's gonna make a loud noise, everyone. So if you need to turn your volume down, please do that.
Should I put garlic in my drink?
No. Please do not.
I'm only asking for the people in the back.
I answer for all of them. Oh man. Baby cub.
Huh?
I'm responding to comment. Yeah, so pain spikes are one thing that hit it for me, but it's not a pain for me because I'm always in
Pain.
a very high level of pain. So, Pickle said, do it. I double dog dare you.
Do it.
Please don't. His pores already smell like garlic.
I bet you won't do it though.
No, I won't.
Everyone, Rachel's birthday is coming up.
What? Huh? Who's having a birthday?
Rachel's birthday is coming up. All she wants for her birthday is to be able to get her passport.
Yeah, well. It's the truth.
Here we go.
My birthday is August.
Yeah, it's in August. Just leave it at that. It's definitely in August.
Vic asked for you to make her some wings now.
Who? You didn't even make them.
I said Vic asked you to.
Oh, okay. Yeah, come on over. I'll make them.
Moria's hilarious. Pickle and I sang that earlier today. That's awesome. Happy almost birthday.
Yeah, I remember when it was almost my birthday.
My husband's a really good cook. Chandler says you need to get some Otter Pops.
Stop playing with me, Chandler.
I agree. He needs to get some Otter Pops.
I did want some Otter Pops today. That's why I'm making this.
Oh, Miss Tay, how are you doing tonight? Did you get to see any of the CEOs? I'm very slow tonight. I'm sorry, everyone. Because I freezies!
Let them know that we want to bring more opportunities to them like this. And we're trying to start a nonprofit. With the nonprofit, we'd be able to help for situations just like that where you cannot afford this. So we're going to, I think we should open up a place where we can accept donations to build the nonprofit.
Okay.
Because that's what we're working on right now. And this is the exact reason why I wanted to build the nonprofit.
I'm sure that you guys heard what he said.
I don't know if they heard me.
Somebody put a thumbs up if you heard what Justin was saying.
1, 2, 3.
Addie said she...
You alright?
I'm fine.
Alright, good. Do you remember?
Whew, sorry about that, guys. I couldn't really function all the way with that noise in my head.
So got the noise in your head?
Not now. I just it was going loud, you know.
What about the raindrops? Whoop whoop! That's the sound of the police.
Yeah, I'm fine.
Alright, good.
Woo. I am okay. I am okay. Sorry about that, guys. I'm feeling stuff in my brain right now, but that's really fun. Yay! I got it. Hello. How is it?
You want some?
No, I said, how is it?
It's okay.
I just kind of screamed it at you instead of saying it nicely. I'm sorry. You want to hold this?
Yo ho.
Did you? Did you? I'm sorry.
You're fine. Dang, where's the chicken at?
I don't know what you're talking about. The chicken has literally fall off the bone. Like.
Yeah. I greatly appreciate y'all. I'm going to sign off. Good night. Good night, Addie. Thank you for joining
Good night,
us.
Addie. Thank you for signing up your daughter.
Yes, it's strawberry, but I don't do banana. So it's strawberry and it has some other stuff in it. Some green stuff I got up in the
Bloom.
cabinet. Huh?
Bloom.
Some bloom in it. Rachel's eating the oven fried chicken that I made. Oh man, this is good.
I think I was hungry.
Yeah?
I didn't really eat very much tonight because I couldn't eat earlier. I'm sorry.
What looks good?
Which one? His? Mine. He made both. What's up?
Your smoothie's in the kitchen. I made a whole bunch of it actually,
You always do.
which was real stupid, but I was super thirsty and I'm not gonna drink it now. So anybody who wants some, come get it.
Oh shoot, you scared me.
Who? Oh my God, he's still here? Oh my God.
You
Still
smelled
here,
the
bro.
chicken.
Where's the remote at? Y'all see this?
Wrong way. I'm eating this chicken, Bear. What?
Don't look at me. I fed him fish yesterday.
I know you did. You fed him a lot of the salmon yesterday.
Yeah, he kept sitting there staring
I'm
at
not
me, bro.
sharing.
Which is probably why he gave me a dirty look today.
Because you didn't share?
Mm-hmm.
He was like, yo, we had a deal, sir.
Carpool.
Come on over.
Yeah, even the cat wants some chicken. Look at him.
Yeah, the cat's fat, though.
Her cat is fat.
Mm-hmm. Aren't you? Aren't you, little tubbers? Hi. I mean, you eat a lot.
Look at him taking up the whole armrest, though. Look at him taking up the whole armrest, bro. He not adorable. Don't give him any compliments. Look at him. Bro, you breaking the armrest. Move. Bro, you breaking the armrest. Move.
Don't weight shame.
Look at him. Look at him. He about to beat you up if you don't feed him.
I know he is.
He moved closer. Who moves closer?
I know what you're talking about. I'm not sharing, dude.
They said not fat, just pleasantly plump. He's adorable. I know y'all have never seen. Y'all usually see Gigi. Y'all don't get to see Bear. Bear usually is hiding under the bed somewhere. Mm-hmm. But the kids are in our room playing video games.
And the dogs are in Israel.
And the dogs are in Isabella's room. And I don't even know where Gigi is. So I'm afraid to find out. Oh, they probably still have her in her book bag.
She was bad earlier.
Oh, was she bad earlier? What'd she do?
She kept trying to get in the baking powder.
In the baking powder?
Yeah,
Oh, yeah. So she's probably still in there. I'm clear over on the West Coast. Yeah, well, come on over, Miss Tate. Ew, man, don't kiss him.
I didn't.
Ugh.
He was sniffing me.
I know where his nose has been.
I almost said something mean about you.
On his face, but still. Did you feed him? Oh my gosh, don't feed him. Look at him. He just gained 200 pounds right there.
Was that gristle good?
Come on over, Miss Tight. Bear, get down, bro. He shook the whole couch when he jumped up here earlier.
I don't know what you're talking about. He telling stories on you.
He did. He shook the whole couch. I was there. All right, guys. As you can see, we have to feed her animal. She's feeding him fried chicken, y'all. She's feeding him.
No, I'm feeding him fried gristle.
Baked fried gristle. That's what she's feeding her cat, bro. Mm-hmm. This is weird. We're literally Bear. You don't need to show people your booty. Come on, bro. We need to put pants on him.
I'll let you do that, sir.
Somebody say, "Hey, I feed my cat." Do you feed him chicken though? Like really?
Justin, did you feed him salmon last night?
It's not about me right now. I'm not on live. I mean, I'm not on live feeding him. I fed him salmon. Yeah, I did it. I don't care. It's not my cat.
Do you guys hear that? He literally just fed him last night. Like big chunks too.
Show me the tape, bro.
Okay, I'll pull it off.
Show me the tape. Oh, yes. We have a video that we will be posting.
Oh, yes. For some.
In 5 minutes for the subscribers of Gigi today. And what she did caught me off guard.
It surely did.
So in 5 minutes, we will be posting a video of what Gigi did for the subscribers
so
only.
We're getting off the live now?
Yeah, we'll be getting off the live soon.
In 5 minutes, it will mean we have to get off the
Yeah, I know.
Okay.
And what she did really blew my mind. But if you don't have to take my word for it. Just ask the lifeguards. One of them is Pickle. She's right there.
I'm so hungry.
Oh yeah, I ate the pancakes earlier, Pickle. But the egg, no, absolutely not. That was the grossest thing I've ever eaten.
He didn't even tell her thank you.
Yeah, I love my daughter now. I love her. So I don't care. I ate it because my daughter made it. I suffered and gave it back to her. She made some good pancakes though. Hey Mallory.
Now you don't run away? Bet. I wasn't very nice, dude.
Yeah, my daughter's trying to learn how I make my eggs. I gave her a recipe. Like I sent it to her, the recipe of how I made my eggs.
There you go.
But she was on the phone instead of watching the eggs, so she served me burnt eggs. Get your arm out my drink, bro. I need a new cup.
Go. Hi, Mallory.
Help me up.
I cannot.
Bro.
I cannot.
I'm sunk down.
I want to remind you that you're on live.
It's past 10 o'clock. You know that's my bedtime.
Oh, I know I could hear you complaining about it the whole time you were eating it.
Thank you. That didn't do nothing. I'm still sunk down. What is that gonna do, bro? What was that? Come on, bro. Help me up. Help me up. Take the cup, bro. Take the cup. Take the cup. Cletus.
Stop.
Got me in the corner. Why don't you ever sit in the corner? You know I'm 6'5". Why am I always in the corner? Nobody puts baby in the corner.
I do. Oh my gosh. Oh. Good night, Vic. Oh. Wow. You all right, big guy?
No, bro. Always got me sitting in the daggone corner.
I don't know what you're talking about. Half the time, he's the one who sits down first. The other half, I do. Oh.
Okay, I'm done.
What are we done about?
Oh, I'm about to go to sleep.
Oh, because I go too?
Yeah, you can go to sleep.
Oh. That means we have to say goodnight.
You ain't got to go home. You can't stay here. Have a good night, y'all.
You'll have to go and turn it off. I don't think I can right now. I'm sorry.
I'm so awesome. Awesome.
Yes.
Awesome. Oh, man. Everybody's here now.
Justin, sleep? That's the funniest joke I've heard all year. You gonna sit down and talk a little bit more?
No. I'm so tired.
What, you mean you're actually gonna take care of yourself, Justin?
No, I'm going to do some more work, but still.
Oh, thank you, Mrs. Tate. We love you guys. We really do. Every single one of you guys in the community, you each have a place in our hearts. I'm so sorry. Justin. I wish you guys could see him all the way. Oh no. Oh. Whew. Sorry about that. Oh, you're very welcome, Vic. Morgan, chew carefully.
Oh my God, there's so
no.
much. I'm not going to be able to get through a picture of this. Who puts only strawberries and water in a pitcher and drinks it? Worst idea ever. Worst idea after 10 o'clock.
Oh
Worst
my gosh.
idea. And then who chooses a straw this long?
Chandler says chug it. Oh my gosh.
I think I'm going to sleep with the pitcher. This is the stupidest thing I've ever done. This is only cup 2. I can see the picture from here. And it's mocking me.
Oh my gosh. Oh.
You okay?
I'm good. Are you okay?
I don't think I can bend over. The problem with strawberries is there's water involved. So when you put water with water and a little bit of flesh from the strawberries, it doesn't taste good. It's a mistake. It was a mistake. I love strawberries, but not that much. My glasses are falling off. It was the dumbest thing I've ever done.
Oh my gosh. How much more you got left?
Oh, forget this, bro. I want to quit, but my OCD won't let me quit until I get to the bottom. And you would think I'm at the bottom, but the way straws work, you're always at the top.
Oh my gosh. Oh man.
Oh, started off with a flavor. Now the flavor's regret.
You got this, baby. You got this.
I don't got it. I don't got it.
Oh no. Oh no.
Ooh. Oh, my mouth was watering. No, the water's coming from the wrong place.
Oh my gosh.
I can literally see a picture over there, bro. I'm pouring that down the sink.
Oh my gosh.
Oh, I don't think my pants fit anymore.
Justin, are you
What?
done?
I want to be.
Just put it down.
I don't know how.
Oh, honey. Are you almost done there?
No, it's foam. And a strawberry that didn't get mixed up. Where did it even come from? Okay, I quit.
Oh.
This is the look of defeat. I got beat by water.
Oh my
Oh.
gosh.
That's disgusting.
Oh. Do
You okay?
it for the gram.
Huh?
Someone said do it for the gram.
Do it for the ground. I already thrown it in the towel.
Oh my gosh, Pickle. It was. I've got it
Look.
recorded.
Turn
I
the
recorded
camera.
his face.
Look.
Oh.
Babe.
Yes, Chandler, I was recording him.
Babe.
Yes, what, babe?
Look.
Yeah, no, he's pointing it out, you guys. Samantha says the porcelain throne shall have a friend suit in your future.
Yeah, get the remote, turn the camera.
Okay, hold on. I forgot I could do that. Oops, wrong way. I'm sorry, guys. Hold on.
This.
No, wrong way. Wait. Okay, there we go.
Oh, God, what was that? Oh!
I'm so sorry.
Nope. 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 I'm done. Nope.
I'm sorry, everyone.
No.
Oh, no.
Did not expect that, actually.
Oh, gosh. Sir, are you okay?
No. Dumbest idea.
Pickle just said that the way that you reacted reminded her of your reaction to when we ate the spicy chocolate.
Yeah, exactly. Anyway, nobody on the channel has ever seen that. I'm standing over top of the front. On my toes.
Oh, Justin, someone said that this is making their night. Laughter is contagious. Oh my gosh.
If y'all want to laugh, go look at our earlier stuff when we actually...
On YouTube. Oh my goodness.
on YouTube. Go find us on YouTube. Go find the spicy chocolate... No. Yeah, it was the spicy chocolate challenge.
Yes.
When we ordered spicy chocolate from some company, and it was supposed to be a mystery of where the spicy chocolate was, and there was only like a few of them in the whole pack. And
Pickle just gave me a great idea. So we're
I'm not
gonna,
doing anything.
no,
Pickle
we're
just
gonna
says.
shut your mouth. We're going to take a clip from that video and post it for our subscribers to see.
Oh yeah, that's cool.
So you'll
but
get to see
I thought she was gonna suggest the spicy chocolate again. I'm not doing it.
We will definitely taste chocolate someday in our
It
future.
will never happen again. Worst day ever.
Oh, it was so hilarious, you guys.
If
Oh
you
my
don't
gosh.
believe me, go look at the video.
Pickle,
It was
please
not a
remind me
joke.
to do that, okay? Pickle, please remind me.
What?
Take that clip and put it for the subscribers.
Okay, yeah.
Are you coming to sit down?
No, I'm going to bed. I was serious. That hurt. I've never drank something that hurt. That hurt. As in my ego. It hurt my ego, bro.
Oh my gosh, Justin.
I'm like literally turning stuff off. Like
I see
quit.
that.
I've never quit like this before. I quit, bro.
Oh my gosh. Oh my gosh. Hello, Martha. How are you tonight? Chandler said go to bed.
I am, but I'm afraid to bend over. Can you hand me your plate?
I can try to.
Oh God! Why does it keep coming back out?
Stop.
It's not me, bro. I didn't choose this body.
Oh, Morgan. Oh, Morgan. Send that to one of the lifeguards for me, please, so I don't forget. Thank you, Pickle.
Oh
Oh my
shit!
gosh. Oh.
This is what happens when your eyes are too big for your forehead. I mean, for your stomach.
Morgan says she would definitely do a spicy chocolate challenge with us.
You can do it on your own. I'm not doing it. I don't know what it is, but I get every time we've gotten something spicy, it was me. Every single time.
Oh my gosh! The truest statement was said. It wasn't me. I didn't choose this body. Oh my gosh. Oh, I'm sorry. Oh, I am dying. Oh gosh. Is everyone enjoying laughing at Justin? That's what I want to know.
This segment is called Justin After Dark.
No! Fully clothed version. Oh my gosh. I cannot with you, sir. That's a very big I cannot. Whew.
God, my body hurts.
My whole everything. I don't know how to get to bed.
I'm gonna help you.
I didn't even bring the wheelchair in here, so
Oh, I ain't gonna help you then.
that's my thing.
I'll go get the wheelchair. Let me put these shoes up.
Yeah.
I'll put the water in the room.
Okay. I
You
mean,
need some water first?
we can have the kids fill it if it's still awake.
Yeah, I'll wake them up because they're in our room anyway.
Yeah. Vic, you're so welcome, and please follow us so that you can see when we have the information coming out from the CEOs, and also we will be having other guests come on our channel as well. Like on Thursday of this week, we're going to have Dr. Julia, psychologist. She's going to be coming and talking with us. So have your questions ready, everyone. Yeah, that's yes. Woo! Oh my gosh, Pickle, put it in the thing. You're good where you are, just don't go past that. Hold on. You cannot talk. I'm glad you joined the live, Vic.
Hold on, Jay.
Oh, Kara, you missed so much tonight. Oh my gosh, we had the CEOs from NeuroAI Monitoring and CEOs from MetaBrain Labs on, and they were talking about the collaboration in the wearable device that I'm going to be starting to beta test. So that's what you missed. Thank you so much, Pickle.
Oh man, we can't even take this all the way down, can we?
No.
We got another one on. Oh, tell everybody about Thursday.
I just did. But on Thursday we have Dr. Julia, she's a psychologist. She works with adolescents. So bring your questions, bring your listening ears, because we're gonna have a conversation with her about how the work that she does with people who have invisible storms like I do.
That are adolescents.
That are adolescents, children.
But it might be helpful to everyone.
Kara, we're actually going to repost the live
Go around
on
the backside. Come here.
YouTube.
She's trying to say you don't want to miss this.
Sorry. I'm sorry.
This way, you know, back up. Put that back on there.
I'm sorry.
Give that to your brother.
I'm sorry.
Put that on the count. And you help me unplug everything.
I'm sorry.
Hold on. I got it. There. Alright, move this back. Everybody move this back.
I'm sorry. I'm sorry.
Jay, move this back to the wall. There we go.
Yes, Pickle. We need to have that announcement up. Can you make one of the little screenshot thingies like you did for tonight for her also, please? And I would love for if you could grab her picture and put it on it. That would be amazing, Morgan.
Jay.
Woo! Ow, ow.
Hold on. Come here, because you're going to take that to the room.
Sorry.
Walk this way. This way. Stay out the
Sorry,
camera.
everyone. I'm trying.
Hold that.
I'm trying.
Walk this to my room. Put it in the chair. Stay close to the wall. Izzy. Take this. Put it back where it goes. Thank you. You okay?
No.
All right, we're coming.
No.
How do I turn this off?
No.
Okay. I got it. I'll take care of it. Give me a minute. Izzy, put this against the wall right here. No. All these lights and stuff, put them in the spare room and then close the door. Got it? Justin, grab the light, put it in the spare room.
I'm sorry.
You good, man?
I'm sorry. I'm sorry.
Put them against the wall or in the closet. Put them in the closet
Sorry
or
about
close to it. What was that?
I don't.
You okay?
I'm fine. I'm fine.
Take that. And this. Give that one to your, give the light to your sister. Okay, you take this. You're gonna take that and put it in there, along with this.
Sorry about that. I apologize. Didn't mean to whatever that was.
We're almost finished.
I know. I love you.
Spare room. Spare room. I think we're good.
Yeah.
What about all these cords? Go in our room?
No, not all of them. The white one is for the child.
Children's?
Whatever they are.
Alright, so where is it?
Ooh.
This goes to your phone.
Mhm.
So we need to charge all the phones. Put everything in our room.
Yes, sir.
Put all that stuff in our room.
Yes, sir.
Let me unplug your computer.
Yeah.
Jay,
Got it.
come here, buddy. Right there.
Oh, that hurt. Ooh, owie.
Pick this
Sorry.
up. Put it in the chair in our room. Oh. Here, cord. Take it, big guy. Okay, almost done.
I'm fine.
Need my wallet.
I sound silly.
No, you don't sound silly.
Yeah, I do. The mouse needs to go on somewhere you know where it's at.
Where do you need it to go?
Either with your computer or on the counter. I'm sorry.
You'll be okay?
Yeah, I'm fine.
About that.
I don't
Put
like
this
that.
on my desk in my room. Please.
Like Pickle said, to everybody, thank you guys for joining
Yeah.
us tonight. Thank you for coming
Put this
and listening and hearing what
on
Kevin
the
and
desk.
Alexandra had to say. Thank you for the opportunity that you guys give us to share
and make sure that
the wonderful work that these companies are doing. So I really appreciate all of you for being here. I'm going to say it again. For those who have non-epileptic storms, go to www.neuroai.com. No, that's not it. www.neuroaimonitoring.com. And scroll down to the bottom of the page. It says a little green button that says how it works. Click on that link and get signed up for the wait list to be a part of the study for the non-epileptic storms. Yeah.
All right, come on.
I know. I'm gonna do that.
Izzy. Come on. Phone.
Good night, guys.
Somebody come push mom to the bedroom. All right, good night, everybody. She's in a wheelchair because her body's been messing up a lot lately, but she's trying to not show everybody. But she might end up back in there. So you all have a good night. All right. Love you guys.